when I came into office, I started studying this issue of what's called opioids. And I was stunned by the statistics. More Americans now die every year from drug overdoses than they do from motor vehicle crashes. More than they do from car accidents. The majority of those overdoses involve legal prescription drugs. In 2013 alone, overdoses from prescription pain medications killed more than 16,000 Americans. 1 year. This, I don't have to tell you, this is a terrible toll. The numbers are big, but behind those numbers are incredible pain for families. And West Virginia understands this better than anybody, because this state is home to the highest rate of overdose deaths in the nation. Now, addiction is not new. But since 1999, sales of powerful prescription pain medications have skyrocketed by 300%. In 2012, 259 million prescriptions were written for these drugs, which is more than enough to give every American adult their own bottle of pills. And as their use has increased, so has the misuse. Some folks are prescribed these medications for good reason, but they become addicted because they're so powerful. At the same time, we've seen a dramatic rise in the use of heroin, which belongs to the same class of drugs as painkillers. It's this class of drugs known as opioids. In fact, 4 in 5 heroin users, new heroin users, started out by misusing prescription drugs. Then they switched to heroin. So this really is a gateway drug. The prescription drugs become a gateway to heroin. As a consequence, between 2002 and 2013, the number of heroin-related deaths in America nearly quadrupled. Although the number of heroin-related overdoses is still far exceeded by the number of legal prescription drug overdoses. So this crisis is taking lives, it's destroying families, it's shattering communities all across the country. And that's the thing about substance abuse. It doesn't discriminate. It touches everybody, from celebrities to college students to soccer moms to inner city kids. White, black, Hispanic, young, old, rich, poor, urban, suburban, men and women. It can happen to a coal miner, it can happen to a construction worker, a cop who's taken a painkiller for a work-related injury. It could happen to the doctor who writes him the prescription. Now, one of the problems we have is too many families suffer in silence, feeling like they were the only ones struggling to help a loved one. And let's face it, there's still fear and shame and stigma that too often surrounds substance abuse. That often prevents people from seeking the help that they deserve. Because when people loosely throw around words like junkie, nobody wants to be labeled in that way. And part of our goal here, I think, today is to replace those words with words like father or daughter or son or friend or sister. Because then you understand there's a human element behind this. This could happen to any of us, in any of our families. What if we replaced a word like junkie with recovery coaches and specialists like Jordan? We can't fight this epidemic without eliminating stigma. That's one of the reasons why I'm so proud of Michael, who's the first person in the job of dealing with drugs in America who actually knows what it's like to recover from an addiction. He shares his own story as a way to encourage others to get the help that they need before it's too late. And I'm proud that there are some elected officials in this state who've told their stories about what's happened in their family and to themselves in order for us to start lowering those attitudes that keep people from getting help. So I've made this a priority for my administration, and we're not new to this. In 2010, we released our first national drug control strategy. We followed that up in 2011 with a prescription drug abuse prevention plan. We're implementing those plans. We're partnering with communities to prevent drug use, reduce overdose deaths, help people get treatment. And under the Affordable Care Act, more health plans have to cover substance abuse disorders. The budget that I sent Congress would invest in things like state overdose prevention programs, preparing more first responders to save more lives, and expanding medication-assisted treatment programs. So we have to make those investments. Rather than spending billions of dollars, taxpayer dollars, on long prison sentences for nonviolent drug offenders, we could save money and get better outcomes by getting treatment to those who need it. And we can use some of the savings to make sure that law enforcement has the resources to go after the hardened criminals who are bringing hard drugs like heroin into our country. So, with no other disease do we expect people to wait until they're a danger to themselves or others to self-diagnose and seek treatment. Every other disease, you got a broken leg, you got diabetes, you got some sort of sickness, we understand that we got to get you help. And we also understand when it comes to other diseases that if we don't give you help and let you suffer by yourself, then other people could get sick. Well, this is an illness, and we got to treat it as such. We have to change our mindset.